So I'm a docs tutor for second year medical students at my school. And part of my job is to help prepare them for their third year of medical school when they go into their clinical rotation. So I have to do 2 hospital visits with 5 of my 2Ts throughout this semester. And now we've approached the second hospital visit. And I think something so beautiful about the role that I'm in is that I remember all of the people that I worked with that kind of made me feel uncomfortable and did not put me at ease. And today, when I was, instructing my student and I asked the patient, like, okay, do you have anything to say to a student doctor? And they were just like, no, I don't really have anything to say, but like, you're going to be such a great doctor someday. And like, you were really good with talking to me. And then they looked at me and said, and it's because you have a good teacher. Like, I saw her asking you, like, okay, are you sure that's all that you wanted to ask? Are there any other questions? Like, she was prompting you in a good way. And so that's great. And then that made me also reflect and say, yeah, because nobody likes a mean teacher. We don't like mean people. And the patient said, yeah, because one time I had a mean doctor and I did not like that and I wanted to fire them. So it is just a smooth reminder that it costs nothing to be nice. And people will learn a lot better in comfortable, easygoing, and stress-free or decreased stress environments. That term of pimping students, I don't like it. I just don't like it. We can just say that we're finding different ways to help people to learn. When my student forgot to ask some questions, part of the history of present illness, I said, okay, well, they told you this was a symptom and this was a symptom. How do we connect the two? What's something that you can ask? Prompting them to critically think. So yeah, it's your reminder. Just be nice, y'all. It don't cost nothing. Be nice. Thanks.